Hi, I'm Shiloh Lancaster. I'm a registered dietitian at Rapides Regional Medical Center, and welcome back to Dish on Diabetes. Today we're going to talk about diabetes and sweets. It's important to talk about sweets as part of our diet. Our diet helps to control our blood sugars throughout the day, and one of the things that we often get asked about is how can I have sweets? And just like anything that you eat, it comes down to portion control. How much are you taking in and how often? Most of the times I tell my patients and I'll talk with them about really focusing on controlling the portions of those sweets. And when I talk about sweets, it could be anything with refined sugars or added sugars, just like cookies, cakes, pies, candy. All of those are okay to have in moderation. We want to incorporate them, of course, in with your diabetic diet as you normally would. So let's talk about how much, our portion size. Usually with a sweet like a cake, a baked good, a cookie, you'd want to keep it about 2 inches, and you'd want to have maybe just that once or twice a week, very, very seldom. These things have a lot of refined sugars, and when I say refined sugars, they tend to raise our blood sugar very quickly. And so we want that to we want to minimize that as much as possible, and the more that we take in at one time, the higher that blood sugar is going to go. So when we take in those small amounts of sugars, those small amounts of sweets, we can enjoy these times with our family during vacations, during birthday parties, and feel like we're not depriving ourselves. Same goes with things like ice cream and other foods that might be naturally sweet, such as fruits or dairy products. Yogurt and fruit are a wonderful part of a diabetic diet and can also kind of curb that sweet tooth you might have. They contain natural sugars and are much preferred over your, let's say, baked goods that have added sugars. The natural sugars that are in fruits and dairy products are combined with things like fiber and protein to help minimize the spikes in our blood sugars. So things like a small half-cup serving of fruit, berries, and then yogurt with fruit topping or granola topping can be an excellent dessert alternative rather than cookies or cakes. There's also the option of, if you have a pretty big sweet tooth, to utilize things like non-nutritive sweeteners or artificial sweeteners. When you're baking at home, there are things like sucralose or stevia, which will give you that sweet taste without giving you the sugar or the calories. And there are baking blends available in the market. There are certain ways that you can reduce the amount of sugar that are in these sweets so that you might be able to enjoy them maybe more often. Also, you can find sugar-free alternatives in the stores as well. Sugar-free candy, sugar-free cookies, and cakes made commercially. I do encourage you to look on the food labels just like you would with any other product and count how many carbohydrates are in there, because they utilize things like sugar, alcohols, and other ingredients to give you that sweet taste, but not necessarily the sugar itself. So it is important to continue to read your food labels. It is important to watch your portion sizes with these kinds of foods, and then to think of an alternative like artificial sweeteners if you feel like you would like more sweets on a day-to-day basis. Thank you for tuning in to this episode of Dish on Diabetes, and we'll see you next time.